Not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. And you can reach us directly at 954-717-7027. I am your host, Louise Gomez. And today we have Dr. Srini Tummala, Florida Vascular Specialist. The address is 3 Southwest 129th Avenue, Suite 101-102, Pembroke Pines, Florida 33027. And the office phone number is 954-852-3831. The email is F as in Frank, V as in Victor, S as in Sam at floridavascularcare.com. The website is www.floridavascularcare.com. And welcome to the show, Dr. Tummala. You have so many credentials. I think it's best that you tell us that. We really appreciate you coming to the show.
No, I appreciate the invitation, and I'm honored to be here. And you know, we do have a location in Broward County, like you were saying, in Pembroke Pines, and we'll have another one north of probably Delray Beach coming up soon in the next 6 to 12 months, which will be great for everybody that needs to see us. But I'm happy to be here, yeah.
Thank you. Can you share with us a little bit more about your humble beginnings? Where did you go to school and medical school and whatnot?
Yeah, sure. I mean, I was born and raised in Lansing, Michigan, so home of Michigan State, but I didn't go there. Of course, my whole family did, but I went to the University of Michigan, and I did my med school there. Then I did residency at University of Wisconsin, and then trained in vascular disease at Miami Cardiac and Vascular Institute, and then went and did a stroke fellowship at UCLA. And then ended up here, in practice. I've been in practice now almost 23 years.
Oh, wow.
And then ended up here, back in 2016, 2017. I kind of came back to South Florida, and here we are.
So at what point of your career or your studies did you decide, oh, I want to go into vascular, I want to be a vascular specialist? Was it any particular?
Yeah, I mean, I worked with some mentors over the years, and they're the ones that kind of introduced me to problems of blood vessels and leg pain, knee pain, and what are the things we can do to fix things, at least initially surgically but non-surgically today. And that's kind of what got me into this area.
So for your practice, does somebody need a referral to see you, or how does that work with insurance to see you?
Yeah, I mean, it's pretty easy. I mean, what are the kind of the roadblocks for people to see doctors in general? I mean, you have to go to a hospital, or you go to an office where parking is tough, and we have easy access parking. We're on the first floor. You don't need a referral to see us. We accept all the major insurances. We can see people very quickly, within usually a day or 2 days, if they call us and they need an appointment fast, or if they want to book something farther out, they can. I think one of the advantages of our practice, Florida Vascular Specialists in Broward County, is that we do all the testing there. What does a typical person do? They make an appointment, they see you, then they say, oh, come back in 2 weeks for some additional testing. Come back, go here for something else, and then eventually 3 months later, you're kind of seeing them for the original problem, which may have gotten worse, or maybe now you've taken off time from work, or maybe it's from kids or family and so forth. And so what we try to do is, when you show up to our office, you not only see us in consultation or see me in consultation, but you get all your testing right at that moment. So before you leave, you kind of have an idea of, like, this is my problem, these are my options, and this is what needs to be done. And then at that point, you can go back and think about it, or you can say, I need you to treat
Right.
me right away. So that's the beauty.
So
of it.
what I'm hearing from you, I keep hearing in my mind the word convenience. Like you're really thinking about the patient first. Like
Yeah.
you're saying you have parking in Broward, that's huge.
Yeah, of course.
So that's a big plus. Your first floor,
Yeah,
convenient,
yeah.
and then no referral, go to see you, and you do the testing there.
Yeah.
So to me, that's a no-brainer. To me,
Yeah.
that's like, why wouldn't I, go see you? So my question to you would be, if anyone's listening right now on the radio, how would they know they would have to see you? Like, what
Yeah.
are some of the, what do people present with to say, okay, I need to call Dr. Tummala and make an appointment?
Yeah, no, I mean, I think the main thing is that, we kind of deal with a lot of problems that people have, whether it's men's and women's health.
Okay.
So whether you have problems with your blood vessels, in other words, leg pain, or you have diabetes and you've got tingling or numbness or discomfort in your feet when you're during the day or when you're sleeping, or you just go out walking and you've got leg pain or knee pain from either a blood vessel problem or maybe you've got arthritis in the knee. We have a lot of therapies now that are outpatient. They don't require general anesthesia, minimal recovery. You're up and moving around later that day and you're able to get back to your normal activities the next day. And I think that's the benefit of that. And then we also deal with women's issues, uterine fibroids. Women that have uterine fibroids, you have either you're anemic or you have problems with pain, discomfort, or maybe you have really heavy periods and things like
Right.
that. Those are things that traditionally, are treated with really invasive surgeries requiring general anesthesia, but we're able to kind of treat you in an outpatient setting with no big incisions. You get a
Wow.
Band-Aid at the access site when we're done. We're able to treat all those fibroids, and you basically go home that day and you get to go back to your normal activities within a day or two with really minimal recovery time. And I think that's the beauty of a lot of the stuff we do. And probably the biggest one now is arthritis of the knee. Everybody has some level of knee pain from
Right.
arthritis, whether you're young or old. And a lot of people are either not ready for a knee replacement or they don't want to have, a surgery. My mom had both her knees replaced, and you have to go to a rehab facility
Right.
for a month. You have to learn how to walk. You
Long
have to learn how to-
downtime, right?
long downtime. You have to learn how to bend your knee again, right, to a certain angle. And so the benefit here is, instead of doing all these other pain injections and gels and things like that, we have a therapy called geniculate artery embolization where we kind of block off the inflamed blood vessels in the area
Wow.
to really cut down your pain. And some people can get, pain relief lasting for up to a year. So that's something that just came online within the past 5 years. I mean, I was one of the directors at University of Miami for years, and we did some of the early studies on this, and now it's really hit kind of the market mainstream, as you can imagine. So that's something that we offer as well.
It seems to me that you're using a lot of new or cutting edge, or maybe I'm thinking back in the day when somebody had fibroids. I heard stories that were not, not pleasant. And so what you're saying to me is now people can have a much different experience.
I think so.
Yeah.
I mean, I think one of the biggest, issues we see, or the challenges that people have now, is it's hard to keep up with healthcare. It's hard to keep up with what's new.
Right.
And if you're not in the kind of the space, or in that, if that's not your job, how are you going to keep up with it?
Right.
And I think right now, what a lot of patients or people that we see tell me is that, I wish somebody had told me about this, earlier. I've had 2 or 3 surgeries, and now I'm here, and you're doing something that treats the whole problem, and it's a lot easier on me and minimal recovery time. And so I think we're trying to get the word out to people that's saying, look, these are all the new things available. And I would tell you that if somebody says you need this and it's an invasive surgery, give us a call, talk to us, and we'll tell you whether we agree or not. We love giving second opinions.
I'm going to plug your phone number in. You just
Sure.
heard what he said. The phone number is 954-852-3831. And that's really so refreshing because a lot of people don't want to directly necessarily have a surgical procedure right away. So a second opinion is, I think, what most people want. And it sounds like you're able to do so many other alternative treatments that can reduce that,
I mean, I think things have changed, right? I've been doing this now almost 23 years, so when I first started, a lot of these things were not available. And now, these aren't experimental treatments I'm talking
Right.
about. These are proven treatments over the decades. They've been around a long time, and there's a lot of science and data behind them now. So,
And I think what's also really good is the location we're in. So South Florida, I believe we have a lot of this great technology because of the demographic, because there's a need for it.
Right.
So, you know, having access to Dr. Tummala's, the Florida Vascular, care, I think having access to his location, you know, if you know of anybody, or if anybody's listening and they have a relative or a friend, or they know of anybody, I think it's really important that they see you because of all the different options that you seem to offer.
Sure.
Yeah. What about, let me ask you this, because you're talking about also, I guess people have diabetes and maybe get neuropathy and whatnot. You know, is it too late to maybe some people think, is it too late to change my lifestyle? Is that going to go away? Or how can how can my lifestyle affect the outcome of maybe what I have? Can we speak into maybe that?
No, for sure. I mean, I think in general, prevention can start at any time. Obviously, the sooner the better, right?
Yes.
You want to try to prevent something from occurring in the first place. And that's the hardest because, you know, if you don't have a problem, you're like, why do I really need to do this, right? So I think that's one of the most important things. A lot of my patients that I see that come to see me, I don't necessarily fix anything or treat them, but I optimize their meds, their medical management. We optimize their nutrition, the medicines they're on. We make sure that their cholesterol is controlled, their diabetes is under control, that they stop smoking, that they're doing all the things that are going to help them in the long run. Even if I have to treat them, we know that people do better when you've optimized all that stuff ahead of time, and then you treat them or fix something, whether it's a blocked blood vessel or it's knee osteoarthritis or uterine fibroids, that you ultimately do better in the long run. So we definitely promote that whenever possible.
And I like that. You're optimizing their whole
try to.
complete story.
Yeah.
You're not just looking at, okay, you have a problem with the knee, let's fix that. No, you're trying to really optimize that. And do you find patients receptive to this type of feedback?
No, definitely. I mean, you know, just last week we had quite a few patients who came in that had high blood pressure, their diabetes was out of control, their cholesterol was high, and they really weren't on any of the really proven medications that they should be on.
Right.
And we were able to kind of get them plugged in and optimize that, get them to lose weight, drop some weight, optimize that as well. And they just, even though we didn't fix anything, they just feel a lot better. Yeah.
So true. Health optimization. I feel like who can't benefit from that? I mean, just having, you know, being assessed and looking at the whole picture and seeing, you know, how can we benefit from
and I think one of the issues right now is that, you know, look, primary care physicians are overworked. They're very busy. There's in South Florida, I mean, we saw an influx of like, I don't know, hundreds of thousands of people over the past couple of years.
Absolutely.
And so you can imagine that everybody is busy, right? And so it's hard for most primary care physicians today to keep up with kind of the latest and breaking stuff in every single specialty. And so it's easy for me to keep up with the stuff that I deal with, and it's easy for other people to keep up with their stuff. And so, you know, a lot of times primary care doctors, if you have leg pain or knee arthritis or fibroids, or you have a big prostate gland, we have a way to treat that without surgery now, which really avoids a lot of the complications and issues. So that's one thing. Venous disease, meaning varicose veins, where not just cosmetic, but you've got bulging veins, you've got skin, discoloration of the skin, you've got pain, you've got discomfort. A lot of those things are kind of like, oh, don't worry about it, you're old, you know, it'll be okay, just avoid it. We have a lot of ways to treat these now to make you feel better that, again, don't require surgery, that are easy to treat, that can be taken care of, you know, again, outpatient with minimal, some local anesthesia, maybe something for pain, and that's about it. So there's a lot of advantages.
There really is. I mean, so many people want options, you know, they want to know that there's different things that they can do. What is the prevalent type of patient that you get? Do you have any particular, like, is it diabetes, or what is the prevalent demographic?
I mean, I think it depends. You know, there's kind of like 5, 6 things we treat, right, related to men and women. I mean, when it comes to vascular disease, meaning problems with your blood vessels, your arteries and your veins, whether that's blockages or leg pain or a tingling, numbness in your feet, skin discoloration, that typically is an older patient.
Okay. We're going to take a quick commercial break. I'm sorry, I'm going to have to cut you off, but we'll be right back.
Perfect.
Okay, we'll continue that conversation. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in. We have with us Dr. Tummala. He is a Florida vascular specialist right here at 3 Southwest 129th Avenue, Suite 101-102, Pembroke Pines, Florida 33027. The office number is 954-852-3831, and the email is F as in Florida, V as in vascular, S as in specialist at floridavascularcare.com. Thank you so much for returning back to the show.
Thanks for having me.
I think what we were discussing, I was asking you, like, what are the top most prevalent cases? Maybe we can continue that and then talk about what are the treatments, get a little more into depth on those.
Yeah, so the way I kind of categorize it is I say, okay, there's problems with your blood vessels, whether it's arteries or veins. These are typically patients that are smokers, high blood pressure, high cholesterol, diabetes. You know, and a lot of patients with diabetes will have diabetic neuropathy. So, you know, what are the treatments available for all these problems?
Is that like a tingling? I'm sorry to interrupt you. Is that like a tingling in the legs?
Yeah.
It's kind of like numb?
Yeah, typically it's like pins and needles, numbness or tingling or burning sensation in the toes and kind of the distal part of your foot.
Okay.
It can happen, you know, usually it's constant. But then if you have a blockage in an artery because of the diabetes, which accelerates this, you know, hardening of the arteries and the fatty deposits within it, that can be made worse. And so there are treatments like opening up blocked arteries, angioplasty, stent placements, things that we do in the heart when people are having heart attacks and chest pain. We do the same type of things with blood vessels throughout the legs and throughout the body, and just improving the blood flow oftentimes can at least make it less severe. Even if it doesn't make it go away completely.
Okay.
I think we also have things like, you know, people have vein problems, varicose veins. We can laser them, we can heat them, we can close them. No incisions, no surgery. We can get rid of those bulging varicose veins and try to improve that skin discoloration. We've got patients who have uterine fibroids. We can block off all the blood vessels to all the fibroids in the uterus. You keep the uterus, you keep the ovaries, no surgery, no incisions.
Wow.
Outpatient procedure, and then those fibroids shrink over time. We've got men with big prostate glands who are having all the problems. Surgery can sometimes cause really bad complications. It's recovery time. We can do the same thing and block off the blood vessels to the prostate gland itself to shrink it, improve the symptoms, and then they get better with, again, an outpatient procedure. And then obviously there's knee pain, right?
Yes.
Arthritis is a big thing. You're a weekend warrior, you're an athlete, either way, young and old. If you've got arthritis and you have knee pain and you've been using pain injections and fillers and some of these other things that don't last very long, they're expensive, we've got therapies where we can block off all the inflamed blood vessels to the knee, again, outpatient through a little access site in the wrist or the groin. You leave with a Band-Aid, improve your symptoms, hopefully get you back to your normal activities without having some type of invasive knee surgery. Obviously, there are patients that need surgery, but these are the ones that are candidates for these things.
I like
That's what we
that.
try to do,
So I did have a question. how would somebody know, and obviously I wouldn't know this, but I figured I'd ask, how would somebody know if they're beginning to have a prostate? Like, what is the challenge? What are some of the preliminary beginning symptoms that they may?
Yeah, I think knee pain, I think vascular disease is easy. You're walking, you have leg
Yes.
pain. You're waking up at night because you have pain in the foot or numbness, tingling, and things like that. Or you're walking around and sitting and you have just discomfort in the leg, aching and heaviness.
Right.
Those are easy. People with uterine fibroids, women are going to have heavy periods, they're going to have pelvic pain, discomfort, anemia, those types of things. Big prostate gland, difficulty urinating, or they
Okay.
have frequent urination, or they feel like I have to get up 5 times at night to urinate. Those are all the common things there for a prostate. And then, you know, varicose veins or bulging varicose veins and
Sure.
skin discoloration and things like that. So
Sure.
there's a lot of those things. So I think it's kind of easy when you think about it.
No.
They're all kind of common things that a lot of doctors might say, oh, don't worry about it, or you need an invasive surgery. Let's remove an organ. I think those are
Yeah.
things we want to avoid, right?
And the reason I ask is because sometimes people may be listening, or I'll speak for myself, you know, as things start to happen and it's like, oh, I'm just getting older. It's okay, it's
Yeah,
part of the
right,
process.
right.
But no, when we tune into our body and really, you know, realize, okay, I'm getting up to urinate 3 times a night or whatever the case may be. So maybe little changes as we age. I can speak for myself because I'm getting there. And so, you know, it's kind of like really, I think, tuning into our body. And we have
Yeah.
actually like 2.5 minutes left. So I'm
Yeah.
going to ask you if you can share with us maybe what would you suggest for patients, or if you want to share a feel-good story about a success story you've had,
Sure,
whatever
sure.
you like in the next 2 minutes.
Yeah, I mean, I think the way to think about it is that, you know, it's easier to take care of things early in the
Yeah.
process than later on, right? It's like your car. If you're going to get your spark plugs or your battery replaced, that's easy. But if you wait 10 years, 20 years, and the thing's falling apart, that's a much bigger job to fix and repair. And sometimes you can't get it back to the way it needs to be, right? So I think if you have diabetes, if you're a smoker, if you have high blood pressure or high cholesterol, and you've got skin discoloration or leg pain or knee pain or bulging varicose veins, any of those things, come see us. You know, it doesn't mean we're going to treat you.
Right.
Maybe we just give you, you know, some conservative therapy and you're fine. You're good to go. I think if you have uterine fibroids and you have symptoms related to it, and every woman that has it knows those
Oh,
symptoms,
yeah. Oh, definitely.
come talk to us at the very least, because there's a lot of things that we're doing now that a lot of gynecologists are
Yes.
not talking about or don't know about at this point. And these are all proven therapies again. And
Absolutely.
the same thing goes with enlarged prostate glands and for knee osteoarthritis.
Thank you. Wonderful. Thank you so much for coming
Thanks.
to the show. We appreciate all that
Appreciate
you
it.
do.
Yeah,
Absolutely.
thank you so much.
Take
I was
care.
honored to be here.
Thank you.
Thanks.
Wonderful.